Hello, Dr. Goodwin.
Hello, is this Paul?
Yes, it is.
Hi, how are you?
I'm doing very well.
Okay, let me introduce my Health Power audience to both you, Dr. Paul Underwood, Medical Director of Interventional Cardiology at Boston Scientific, and also Dr. Wayne Batchelor, Interventional Cardiologist at Southern Medical Group in Tallahassee, Florida. I understand that Dr. Batchelor is co-PI or co-principal investigator of a special study called Platinum Diversity, which is looking at examining women and minorities undergoing coronary stenting procedures. And I should mention also, Dr. Underwood, that I'm aware that you are the medical director of Close the Gap, which is Boston Scientific Health Equity Education Initiative. So how did I do on my introduction?
Sounds perfect.
You hit it up,
Great.
hit the nail on the head.
All right, so now let's ask a few questions here. We don't have a lot of time, but my Health Power audience will certainly benefit from what we have to say. Dr. Batchelor, tell us something about the study.
Okay, well, Dr. Goodwin, the purpose of this study was to try to comprise data in some underrepresented groups for heart disease. In the past, most clinical trials that serve as the basis for treatment modalities that we use to treat our patients came from largely white male participants in clinical trials. So when you look through the literature, you see very little about outcomes in women and minorities. In order to try to close this gap, Dr. Moran, my co-principal investigator at Mount Sinai Hospital, Boston Scientific, the study's sponsor, and myself, as well as several others, came together and wrote a protocol up to try to address this. What we did was we took 52 centers across the United States and asked them to enroll only women and minorities into a registry so we could collect data on those particular groups of patients. And then we had them compile their data and adjudicate it at 1 year. We had independent adjudication by an events committee. And then we looked at how women and minorities did after their stent procedure relative to known information that we had on the same stent performance in white men. What we found was that women and minority tend to present with different risk factors at the table than white men on average. For example, women are slightly older on average, and minorities and women both have a higher rate of diabetes, high blood pressure, and kidney problems on presentation, as well as congestive heart failure. Their arteries tend to be a little bit more calcified, and there are some other factors that are a little bit different. But even when we take into account these differences, at 1 year, we were very surprised to see the differences in outcome. For example, if you're female and minority after a stent procedure in this study, you were 4 times as likely to have a heart attack after presenting for your stent procedure. This was not relative to the stent. It seemed to be independent of the stent. The stents were performed well in all groups. The outcomes were similar for the stent procedure, and the recurrence in the stent was equal. So this seemed to be the heart disease itself progressing at an alarmingly higher rate in women minorities than we would have expected. So we felt this was very important for the public to understand more about, and for physicians and researchers to understand about, because again, the data is relatively new, and it's a unique study.
That's very interesting to know, and I'm gathering you're finding more, let me say, less good outcomes in minority women than in white women.
Yeah, there were trends in that regard. Now, to be honest with you, we have to be careful about slicing and dicing all the data. The purpose of the study was primarily to compare women and minorities to white men. And we were able to look at the comparison between minority women and white men, and there were these differences in those groups. The differences were less in white women versus minority women, for example. And minority men versus minority women. But the biggest difference that we saw was in the highest risk group happened to be minority women. And that, again, showed a marked increase in heart attack risk relative to white men who served as kind of the comparator group.
And Dr. Underwood, what would you say was the most striking thing from the study from your perspective?
Well, at Boston Scientific, we're very pleased that we're able to provide clinicians with more information on how they can treat their patients. In the past, the body of information has largely been gathered from white males without much attention being specifically directed toward women or minorities. Now, with these clinical data, clinicians can now better hone their therapy to try to address the risks that are specific for these subgroups. We think that this is a catalyst for others to be able to collect this information as well, because we feel it's all very important as clinicians decide how they're going to treat their patients to have the best outcomes. We also feel it's very important for patients themselves to understand how they can get more information, and certainly visiting websites like Health Power for Minorities or our website, yourhearthealth.com, is very important in terms of knowing what your risk factors are that you can discuss with your physician to come up with the best care plans.
Yourhearthealth.com is your website, correct?
Yes, that is the website for Close the Gap, which is the Health Equity Initiative of Boston Scientific.
Okay, now I noticed, and of course I'm aware of the stenting procedure. Both you and Dr. Batchelor mentioned the stent, and I know that Boston Scientific is a leader in that field. But for a consumer audience, would you just say a few things about what the stent does?
Yeah, a coronary stent is a small metallic device that can be implanted in the heart arteries in order to release blockages that form from heart disease. So patients who present often with chest pain or sometimes heart attacks and have a blockage, this blockage can be alleviated by implanting a stent. The stent used in this study was the Promus Premier stent, which is an FDA-approved, very effective stent that we used across all patients in this study, and it performed well. And I think the information that we got out of the study was not necessarily a lot of stent information. It was more information about these demographic groups and how they actually have slightly different risks of adverse events after the stent's implanted.
Okay, and what difference, either you or Dr. Batchelor, would you say patients need to do, and how should they handle themselves differently once you find the greater degree of disease?
Well, I think the first thing to do is seek medical attention. So these are nuanced questions that you'd have to discuss with your healthcare provider, but some simple messages can be followed. For example, if you're overweight, losing weight is important. If you're diabetic, having your diabetes addressed, your blood pressure, your cholesterol, know your numbers, know your cholesterol and your blood sugar levels. And if you're inactive, exercise. If you have bad dietary habits, ask about diet and ways in which you can improve your diet. There's some personal responsibilities that we can take on as individuals and as patients that are probably just as important as anything else. For example, a stent or anything else that a physician can do. Finally, if you're a smoker, you can probably cut your risk in half by simply stopping smoking. So there are a lot of things that we can do just as individuals, honestly, to impart a lower risk on our risk of heart attack in the future.
Okay, so actually, earlier detection and better treatment is the key word to follow.
Absolutely, and this is particularly important in those higher risk groups, for example, minority women.
Yes, I do think it's important for us to mention that the whole bottom line, if I could use that term, on the Platinum study was looking at the differences, health disparities, or differences in status and outcome for minorities and women who are minorities in particular. Is that correct?
Yeah, I think that's it. It's very important.
Okay, well, I enjoyed talking with both of you, and I'm sure our Health Power audience will enjoy learning from you. I'm going to mention again your website, which is yourhearthealth.com, the Close the Gap website, and of course, we will be putting information from this discussion on the Health Power website as well. So there'll be two different sources from which people can learn quite a bit more about the study.
Very
Thank
good.
you.
Thank you.
Thanks, Dr.
Okay,
Goodwin.
good talking to both of you.
All right.
All right,
thank you.
take care.
Bye-bye.